Welcome to the deep dive. Today, we're getting into something really fundamental for your health.
Yeah,
It's all about sharing your complete health history with your doctors. Now, it might sound simple, but honestly, it's like giving yourself a secret weapon for better care.
it really is. And it helps you dodge potential problems, medical errors even.
Definitely. So we've dug into quite a bit of material for this.
We've looked at insights from Joint Commission International. There's, big on global healthcare quality standards.
Right? The gold standard people.
Exactly. And also the National Accreditation Board for Hospitals and Healthcare Providers, NABH, which is key for setting benchmarks, especially here.
Okay.
Plus, we've drawn on practical advice from groups like Supreme Medic Consultancy, looked at connectivity through platforms like HospiMatch, and some really insightful unattributed texts, too. Real ground-level stuff.
So a good mix. Our goal today, our mission, if you like, is pretty straightforward, but so important. Really get why giving your medical team the full story is, well, essential.
And what that full story actually includes. Because sometimes people aren't sure what counts.
Exactly. Okay, so let's kick things off. The big question. Why does sharing your complete history matter so much? What are the real stakes here?
Well, fundamentally, your doctors, your nurses, they can only piece things together based on what you tell them. It sounds obvious, I know.
But it's often overlooked.
Yeah, our sources really highlight this. People forget things. Maybe they feel a bit awkward sharing certain details. Or sometimes they just don't realize something is relevant. And that, unfortunately, can lead down the wrong path. Maybe a delayed diagnosis or treatments that aren't quite the best fit.
It's like trying to solve a puzzle with missing pieces, isn't it?
Precisely. But when you do give them the full picture, the benefits are, well, pretty significant.
Okay, like what can you expect?
Well, first off, it allows for truly comprehensive care. Your doctor gets that bigger view, that holistic understanding of your health. This helps them spot links, maybe between things that don't seem connected, or identify risks that aren't immediately obvious. Maybe a childhood illness could affect how you react to a drug years later.
Huh. Interesting. So it's about seeing the whole pattern, not just like isolated dots.
Exactly. The whole tapestry, as you said earlier. Then there's error prevention. That's a huge one.
Right. Avoiding mistakes.
Not in your allergies, any past bad reactions to medicines, other conditions you have, it's absolutely critical for your team. It stops them prescribing something harmful.
Yeah.
Think about a serious allergy, like to penicillin or latex. If that's not known, a routine procedure could suddenly become very dangerous.
That really brings it home. Okay, so better overall view, fewer errors. What about the actual decisions being made about your care?
Well, a complete history just leads to better, more informed decisions for everyone involved.
Meaning?
Doctors can make smarter choices about diagnosis, about treatment plans, about prevention, because they have the full context. And importantly, it also supports shared decision-making.
Ah, so you get more involved.
Yes, you become an active participant because you understand the why behind the recommendations. It's a partnership, really, built on having all the information out there.
So you're not just being told, you're understanding based on your specific health story.
Exactly. And that leads right into the next point. More personalized care.
Tailored to you.
Right. When your team really gets your health journey, they can customize treatments and preventative steps just for you. One of the sources we looked at put it perfectly. Your health history is the foundation for everything your doctor decides.
Okay, the foundation. That makes a lot of sense. So we get the why. Now let's get into the what. What actually counts as health history? It feels like it could be a massive list.
It can seem daunting, yeah. But we can break it down. Let's start with past illnesses and surgeries.
Okay.
This means any chronic conditions, diabetes, high blood pressure, asthma, heart problems, this sort of thing.
Right, the long-term stuff.
And also past infections, even things from way back, like TB, jaundice, typhoid, even COVID-19 now. Plus, any major injuries, any operations you had.
So that broken leg from when I was 10, that might actually matter.
It could. It's part of your overall physical health story. Next up, current medications. And this is crucial.
Not just prescriptions.
No, absolutely not. You need to list everything. Prescription drugs, yes, but also over-the-counter things, vitamins, supplements, inhalers, insulin, any injections.
Okay.
And even Ayurvedic, homeopathic, or herbal products. Because these can sometimes interact with other medicines in ways you wouldn't expect. The doctor needs the full list, period.
That's a really important point. We often forget those supplements or herbal teas count as medical. Okay, what's next?
Allergies. This is non-negotiable. You have to be specific.
Meds, food, materials.
Exactly. Meds like penicillin, foods like nuts or shellfish, materials like latex. An unknown allergy can be incredibly dangerous, even fatal during treatment. So, super important.
Got it. Critical info.
Then, chronic conditions, again, we mentioned them, but it's worth repeating. Ongoing things like thyroid issues, epilepsy, kidney or liver disease, cancer, arthritis.
And mental health, too.
Definitely. Mental health conditions like anxiety, depression, bipolar disorder, they're all part of your overall health and absolutely need to be shared. Physical and mental health, they're completely linked.
Good reminder. What else is on the list?
Family history. This gives really valuable clues about your potential future risks.
Okay.
Tell your doctor about diseases that tend to run in your family. Diabetes, heart disease, certain cancers, genetic disorders. It helps them gauge your risk and suggest screening or prevention.
So if my dad had heart problems young, I should definitely bring that up.
Absolutely. That's a key piece of the puzzle for assessing your risk.
Sure.
Then there's social history.
Bush covers.
Lifestyle things.
Yep.
Smoking, alcohol, tobacco, any substance use past or present. Also, your job, actually.
My job. Why?
Some occupations have specific exposures or risks. Think construction or working with chemicals. And also relevant sexual history, which of course is shared privately and appropriately with your doctor.
Okay, that covers a lot of ground. Influencing health from different angles. Anything specific for women?
Yes, good point. Reproductive and pregnancy history is vital for women.
Like what exactly?
Details about periods, regularity, any issues, past pregnancies, any complications during pregnancy or birth, use of contraception, menopause status, all very relevant for many aspects of health.
Right. Okay, that's a really thorough list of what to share. Now, how do we actually do this effectively? It's a lot to remember when you're sitting in the doctor's office.
It is, and appointments can feel rushed sometimes, can't they? The absolute key is honesty and being thorough.
Even the embarrassing stuff.
Especially the embarrassing stuff sometimes. Don't hold back because you feel awkward or think something is irrelevant. Doctors have heard it all, truly. They need the information to help you best.
Okay, trust the process. So, practically speaking, how can we prepare?
Well, one great tip is to actually write things down before your appointment, particularly if it's a new doctor.
Like a cheat sheet.
Exactly.
Yeah.
List your past conditions, surgeries, all your current medications and supplements, dosages if you know them, and a summary of your family history.
Makes sense.
And bring relevant documents if you have them. Old medical records, recent lab results, vaccination records. It saves time and gives them concrete data.
So doing a little homework pays off.
Hugely. And remember, this isn't a one-and-done thing. Your health history evolves.
Ah, right. It needs updates.
Exactly. Keep it updated. New diagnosis, change medication, significant family health event. Make a note. Review it periodically.
Good habit to get into. Are there any tools or apps that can help manage all this?
Yeah, there are actually quite a few helpful things now. Personal health records, or PHRs. You can keep these digitally or on paper. They help you organize everything.
Okay.
For family history, making a family health tree is good, or there are online tools designed for it. And lots of clinics now have patient portals.
Oh, yeah, those websites where you can see results.
Right. You can often view your records, check test results, sometimes even message your doctor's office. They could be really useful for keeping track and staying informed.
Sounds like good options for staying organized. Okay, on the flip side, what are the common mistakes people make? Things to avoid?
Well, the biggest one we keep coming back to is holding information back.
Out of fear, embarrassment, forgetfulness.
Yeah, all of those.
Yeah.
But even things that seem tiny can be the missing piece your doctor needs. So rule one is don't omit things.
Okay. What else?
The opposite problem, maybe. While you want to be thorough, try not to overwhelm them with totally irrelevant details. Focus on what matters for your health right now and your history.
Right. Find that balance between complete and concise.
Exactly. It's a bit of an art. And finally, a really important one. If you don't understand something your doctor says, ask.
Don't just nod along.
Please don't. Ask for clarification. Understanding your health, your treatment plan, it's vital for you to be part of the process. Never leave feeling confused.
Absolutely. No such thing as a silly question with your health. Okay, let's zoom out a bit. How does me sharing my history connect to the bigger picture, like healthcare quality and safety systems?
Great question. It connects directly. Think about organizations like JCI, Joint Commission International, or NABH here in India.
The accreditation bodies we mentioned earlier.
Right. Their entire mission revolves around making healthcare safer and better quality. And a huge part of that is having accurate, complete patient information. It's foundational.
So they set the standards.
They set standards, they assess hospitals. JCI does this globally. NADH focuses on establishing and operating accreditation here. They push for systems that ensure patient safety.
And my sharing my history helps my hospital meet those standards.
In a very real way, yes. When you provide accurate info, you enable your caregivers to work more safely and effectively. That aligns perfectly with what JCI and NABH are striving for. Even groups like Supremedic, who consult with hospitals on getting NABH accreditation, know that solid patient information processes are crucial for meeting those benchmarks.
Interesting connection.
And platforms like HospM might focus on finance and infrastructure,
Yeah.
but ultimately, good patient outcomes, which depend on good information, are vital for the health of the whole healthcare system, financially too.
It really is all linked, isn't it? From the individual patient interaction right up to the system level.
It truly is. Your personal responsibility links directly to system-wide quality and safety.
Okay. So as we wrap up this deep dive, what's the single most important thing you want people listening to take away?
I think it's this. Sharing your full health history isn't just, filling out a form. It's an active, essential step you take to get the best, safest possible care that's truly right for you.
It empowers your doctors and it empowers you.
Absolutely. It makes you a partner.
So here's something for you to think about after listening. How can taking charge of managing and sharing your health information really make you a partner in your own care? Maybe think about one thing, just one piece of your history that perhaps you haven't shared before or maybe downplayed. Why could that single detail actually be important for getting diagnosed earlier or getting treatment that's much more effective for you, especially in the complex healthcare world we navigate today?
Yeah, it's recognizing that your story, your health story, is powerful. And sharing it fully is how you use that power for your own well-being.